they weren't going to be able to make today, which is A-OK. I'm going to go ahead and pull up the, oh, Renee's beating me to it. Okay. All right. So, tale of multiple cities. So it does appear that we are in the plateau phase of the Thanksgiving holiday surge. So we'll show in a minute that the curve does seem to be flattening. It's a little bit jagged, but it definitely looks like we are in the flatter phase, if you will, right now, which is great. We are still trending north, and some of that is just incidence of the virus in general, I'm sure. But there are two things that are slightly concerning. Well, three things I will say. So number one, the mortality rate has seemed to start to surge a little bit. We kind of knew that this could happen. It's about the right time, 10 to 14 days after the surge in cases. It is not surging as fast as what we had seen previously, but it is certainly seeming to surge compared to what it was even a couple days or a week or so ago. So that's something we'll have to keep an eye on because obviously that's our biggest fear. We are also seeing that while hospitalization seems to be potentially flattening a little bit, ICU admissions have gone up a little bit over the last couple of days. So that too seems to be a hand-in-hand kind of discussion. The other thing that we're keeping an eye on, many of you may have heard out of the UK at least, they have identified this variant form of COVID, which is more easily transmissible, is not associated with any worse outcomes, is not more deadly or anything like that, but just seems to be easier to spread. So obviously that's a concern, especially right now when we're expecting some holiday exposure risks, that if there is a more virulent form of the virus that's going around, that obviously could make this even more transmissible in the short term. Haven't heard about identification in the US. There was some discussion from one of the virologists in the US who said that it's still too early to say for sure that that's necessarily the case. So whether that's true or not remains to be seen. But the final piece that suggests that this is not over, there were 1 million people who flew who departed from an airport on Friday. There were 1.1 million who departed on Saturday, and they were anticipating at least another million or more yesterday. So pretty significant airline travel. The peak of the Thanksgiving travel was 1.176 million who departed on the Wednesday before, I think it was Tuesday or Wednesday before Thanksgiving. So we're seeing about the same amount of airline travel in the couple of days leading up to this past weekend. So that suggests that we are most likely to see the same type of peak, if not more, than what we saw from Thanksgiving. So something we're going to have to keep an eye on for certain. Here locally, at least for Monroe County, we have seen a little bit of a surge in mortalities over the last couple of days. Hard to say if this is just catch up, but you can see from last Wednesday, I guess it was when we were together, to today, we've had about 40 incremental mortalities. Several of those, just in the last couple of days, although they did not, while they reported the total number of deaths, they did not report the total number in the last 24 hours, but I think it's 8, if I'm counting correctly, looking at the data. So, we're definitely seeing the same mortality trend here. Our percent positive was actually 8.9% as of yesterday, and it's 8.8 today. I think it's like 8.84 or something like that. So we maybe trended down just a tad because yesterday we only had 588 new cases. After the day before, I think we had 705. The day before that, I think we're at 688 or something like that. So Sunday does tend to be the lighter day, and we'll see what today holds. But overall, we're not trending up as fast. We are stably averaging about 655 cases a day over the last 7 to 10 days. And then yesterday was the first time that we'd gone below 600 in several days. We'll see what today holds. So more to come from that, but that's where we stand. But the Christmas travel definitely is concerning, to say the least. If we flip over to the graphics, I'm not sure it's necessarily going to show too much different. You can see cases are still trending up nationally. Statewide, you can see our case rate is higher, but it's not going up exponentially like it has been elsewhere. Mortality is going up still, which is a concern. The percent positivity, tough to say. We're kind of holding relatively stable, I think, locally. Nationally, we're still on an upward trend. And then the hope is that blue curve at the bottom right is the plateauing of the hospitalization. That still kind of remains to be seen. We did have a decrease in the number of ICU patients, however, yesterday, however, that was seemingly coinciding with an increase in 8 mortality. So that may not be the way we want to decrease our ICU numbers. The final graphic, I think, is just the percent positive in 24 hours. This is where you can see as we start to get to that kind of potential plateauing effect. It's a little jagged, but certainly nationally, you get the sense that the best fit line is starting to smooth. Certainly statewide, we're starting to see some smoothing. And then obviously Monroe County doesn't rank when we compare it to the state and national numbers. So it doesn't show up so well in this graphic. So that's that. As far as the regional stuff, Nick Apostolaris did reach out. He did not have graphics from today, but looking at the regional numbers, we are still seeing pretty high incidence in the surrounding counties. So nothing unusual from what we had seen before. Everything's pretty much keeping pace with what we're seeing locally. Okay, now on to testing. So we did talk, I think, at the end of Wednesday of last week, if folks are planning to have some shutdown of their office, if they're going to reduced hours, if you're anticipating your testing to be reduced, especially for our private practice folks who are doing pre-procedural testing. If you can just reach out and let me know, put it in the chat room, send me an email. We're trying to give the lab the best heads up as possible. Although, I don't know how much they're going to change their staffing plans right now, but based upon the relatively small number of people who reached out, I have basically told the lab that we do not anticipate any significant decrease in testing volume here over the next 2 weeks. One other thing, and I don't think this applies to our private practice providers, but we did hear from the pre-procedure labs that there have been an increase as of late of folks getting referred to the laboratory for post-procedure testing before they're allowed to come back to the office, or people who have had COVID to get tested to have a negative COVID test before they're allowed to come into the ambulatory offices. So that does not meet with our guidelines. That should not be how we're using our testing resources. I believe the folks that were named were all actually U of R practices, but please do not send people to have them have a negative COVID test before they come into the clinic to be seen, because especially if they've had COVID, it could take weeks. We really don't know what the anticipated convalescent time where the titer could still be positive. So don't send folks for that, because that's unnecessarily taking away some of our testing resources and further bogging down the timeline of return of testing results. Did also get another couple questions. Folks had reached out specifically about queuing for the vaccine. Should folks, and this specifically was for healthcare providers who had been exposed to COVID, should they be antibody tested? Because if they were antibody positive, they would be tiered lower than folks who had not been exposed to COVID. While it is a reasonable scientific consideration, the best data that we have so far suggests that the antibody response that occurs after positive COVID, after actually having the infection, may be less vigorous than the antibody response that you get from the vaccine. At this point, there is no recommendation as to tier anybody differently, whether they've gotten COVID yet or not. There's been a host of questions about how much frontline exposure, how much testing and the like. how much actually doing testing on patients would potentially move someone up or down the list. Right now, and I understand and I agree that it could be more perfect, it could be more granular, but as you can imagine, this is a pretty big effort to try to get everybody vaccinated on a pretty wide scale as rapidly as possible. We are not parsing out, if someone sees 20 patients a day versus 5, someone is working in a respiratory clinic versus, not. We're not getting that granular at this moment. And truthfully, I think the separation of what we're looking at is going to be days before, one person gets the vaccine from another. So rather than try to fight out, who's got the most exposure and I'm bigger risk than you are, it's probably not worth it, quite honestly, at this moment. I've already I saw it pop up as far as, when are we expecting ambulatory healthcare providers and teams to get vaccinated? My best answer to you at this moment is probably sometime within the next 2 to 3 weeks. Obviously, the holidays will slow that down a little bit, but the availability of vaccine is both higher than what was anticipated. The distribution, which was not perfect for Pfizer, as many had heard, does seem to be better, and especially with McKesson taking charge of the Moderna vaccine, they already have a healthcare distribution mechanism that's more in place, if you will, than the military working with UPS and FedEx. So the anticipation is that we will see the Moderna vaccine roll out faster. We do not yet know. While we expect Moderna vaccine to get into folks' hands today, we do not yet know if it's going to be similar to where the vials will be overfilled, as was the case with Pfizer. So the current anticipation that has now been blessed by the Department of Health and the CDC is that you can and should get 6 doses of the Pfizer vaccine per vial. There are sites that are reporting that you can get 7 doses out per vial. Reliably, I think locally we're getting 6, but that obviously is expanding by about 20% the availability of the Pfizer vaccine. I don't yet know what the Moderna vaccine overfilling status may be. But that vaccine should be arriving into pharmacies today. And because of its refrigerator stability, should allow for a little bit easier distribution and administration schedule. So I think all of us are likely to get vaccinated here in the coming weeks. Yes, there are other folks who have reached out to me that have heard so-and-so got their vaccine yesterday. They don't necessarily have the exposure that, they qualified under. Is that fair? No, I guess I could say. There are folks who, one time volunteered in a nursing home and are getting vaccinated as part of the nursing home distribution, but otherwise their exposure risk is much less. We're absolutely going to see that, but truthfully, it's going to be too complicated to try to stand in line and vigorously enforce, certain standards over others. So I think the good news is we're all going to get it very soon. Once we start talking about, when we're going to be vaccinating our patients and our lower risk population. So the average population, we're probably looking to late spring to midsummer before they get vaccinated. So this is just your, generally healthy folks. As far as the 2B group, the group that are high risk patients, the anticipation is it probably could be a couple of months before they fully will get vaccinated. So still working out those timelines. There's another vaccine task force meeting tomorrow where this will be a little bit more clear. And as I've told some, the first agenda item on the task force meeting tomorrow is the discussion around vaccination of ambulatory healthcare workers. So obviously we are getting very close, and I would anticipate by the time we return from the Christmas holidays, we'll be seeing a lot more vaccination of our teams. So more to come on that, but that's what I know as of today. But as far as antibody testing, folks in your office who have been exposed, I don't think it's going to change where they get in line for vaccination or whether or not they should qualify. One other thing I should bring up about the vaccine. Interesting tidbit, there's been several studies or polls that have been put out, whereas the physician community, upwards of 90+% have said that they will plan to get the vaccine when offered to them. Concerningly, the RN community is as low as 40% in certain polls that were performed. And that actually is on par with some other allied health professionals that were asked whether they would accept the vaccine. We already know that we're going to have difficulty vaccinating our minority populations, our at-risk populations, but for healthcare workers, obviously this is a big deal. This is a big exposure. It's important both for the health and safety of our teams, but also for the availability of our workforce. So we're going to continue to have these conversations. If there are educational things that you need for your staff, I know there were some pearls that were put out before that could be helpful, but if there's other things that you need, if you're seeing a lot of reservations from staff members for getting the vaccine, please let us know. That's something we'd be happy to help with if we need something more than what we've put out already. But I don't want people deferring the vaccine for concerns that are possibly not well founded. So we'll talk more about that going along. Final thing I'll say about vaccine. I do feel congested. I don't know why. If I have COVID, it's really going to suck to have COVID a week or so before I could potentially get a vaccine. I woke up this morning. I feel great, but I do have a stuffy nose. I don't know why. I think I'm just allergic to corporate woods now. But if I have COVID, add me to the list of things that suck. But the good news is I'm sitting here all by myself, so I'm not touching or around anybody. So if I do have it, I am really feeling great and doing fine. So next thing, so Moderna on Saturday, there's been like 25 different levels of approval. It did officially get the emergency use authorization. So as I had said, McKesson already had it in hand. The anticipation is that we'll start arriving in offices today or in pharmacies today. So that is good news. I think there are 6 million doses that are going out as of today, with another shipment following closely behind. And it sounds like Moderna's distribution schedule is a little bit ahead of what they promised previously, which is good news. So we may see more Moderna rolling out in the short term. For all intents and purposes, you can think of these as being equal. They're both right around that 95% efficacy. So, very high performing at this moment. As far as whether you should get the Pfizer or the Moderna, really doesn't matter. I do suspect as we start talking about those of us who are in the outer reaches of the southern tier, you're probably more likely to get Moderna just because of stability and storage reasons. Whereas those of you who are somewhere near Elmwood Avenue, I would not be surprised if you were more likely to get the Pfizer vaccine. So more to come on that. Also, as folks probably heard, the General Pena, who's the lead for Operation Warp Speed for vaccine distribution, kind of fell on the grenade, whether or not it was truly his fault, saying that in fact, various states did not get the volume of vaccine that they were planned to receive due to distribution mishaps and miscues. No surprise, didn't go exactly as planned. Nonetheless, everyone will be getting what they're supposed to get one way or the other in the very short term. But there were some states, New York being one, larger states that potentially did not get as much vaccine as we would have hoped and anticipated. And yes, there are other states right now. If you live in South Dakota, you're kind of in high cotton for vaccine for the moment. But there's only like 4 of you there, so it doesn't surprise you that if you got any vaccine, you're probably in high cotton for vaccine at the moment. So nonetheless, all will be made right in the days and weeks ahead. Final thing about the vaccine, several of you have started to reach out, emailing me your tiering for your staff as to whether they have inpatient responsibilities, and if so, at what hospital. If not, are they patient facing and or seeing COVID risk patients? And then the final tier would be those who are healthcare workers but have no direct patient interactions. So if you could send that to me, I've received many, I've not received all. My hope is that what's going to happen is that we're going to get the A-OK that it's time to start vaccinating our ambulatory healthcare workers. And if we just happen to be a little bit faster than everybody else in the community to say that we've already got our tiers established, it may accelerate how rapidly we can get folks in to get vaccine. I don't know that yet. I don't want to make promises that I can't deliver on, but it does stand to reason that they're going to go by who can get it to them most quickly, because they're trying to click off and get these things scheduled very rapidly. So for everyone who is interested in getting that vaccine as soon as humanly possible, the best thing you can do is to send me that tiering information, because if there's anything that's going to accelerate us farther up in the line right now, I think that may be the thing, although I don't have any promises to that effect. One last thing I think I just saw pop up. There have been a couple of reports, very few, about anaphylactic reactions to the Pfizer vaccine. Interestingly, there seems to be a preponderance of that in the UK. Don't know why. However, no one has had any severe anaphylactoid reactions as of yet that were not able to be treated and stabilized. Most got a couple doses of epi and were fine, is my understanding. So there is nothing at this point that is indicative of someone who should not be getting the vaccine, or anything that I think dissuades from receiving the vaccine when it comes available to you. So take that for what it's worth. Next thing, if you have been watching CNN or MSNBC or Fox News or any other news coverage source, you're probably aware that there has been several days of wrangling in the halls of Congress about the stimulus bill that did in fact just clear the Senate last night. This was a $900 billion stimulus, much less than what the Democrats wanted, about twice almost of what the Republicans wanted. So nobody got exactly what they wanted, but nonetheless, it does allow for several things. In brief, number one, it does extend the unemployment insurance. That's $300 a week on top of your standard unemployment pay for anyone who is currently unemployed, and that will extend through March 14th of 21. Number two, anyone making $75,000 a year or less, or a couple making less than $150,000, will each receive a check for $600 apiece. If they have dependent children, those dependent children will also receive a check for $600. So a family of four making less than $150,000 would receive a total of $2,400 in stimulus checks that should be coming out within the next couple of weeks, it sounds like. There was $35 billion in small business relief, both meant to allow for first time and also second time PPP loans. So there should be more funds flowing in that direction. There was about $45 billion for transit. So that's going to airlines, rail, highways, and the like. There's $22 billion that went to states for COVID testing and management and contact tracing. There was $20 billion procurement of vaccine and therapeutics. So that's buying more vaccine, obviously. $9 billion to aid in vaccine distribution. The one that I do not know, there was $9 billion approved for healthcare providers. I don't know what that means. I know that people have asked before. There were supposed to be stimulus payments directly for healthcare providers. I do not believe that's what that is, but as of yet, I cannot find the exact language of what that $9 billion for healthcare providers is for. There was $82 billion for schools to help with the testing and safety parameters within schools, and then $25 billion for renters assistance, keeping on utilities and the like. So lots of different levels to this. I'm sure we're going to be hearing more about it in a couple of days, but for any of our staff who may be furloughed or unemployed or whatever the case may be, there is some protection in there for those folks. And there may be some extra benefits from a small business perspective for any of you who are subscribing to the PPP loans. And then we'll find out what that $9 billion for healthcare providers entails. So more to come on that. Next thing, I thought this was just interesting, but especially as we're seeing high travel and we're expecting get-togethers for the holidays, A couple of scientists out of MIT posted some risk expectations for gatherings. So they both simulated a 20 by 20 room. They did it for Thanksgiving, folks eating around a Thanksgiving table. They had 10 people in the room who were eating, and they tested various types of masks. They tested different airflow parameters. And what they found is that if in a 20 by 20 room with 10 people eating, so they are unmasked eating Thanksgiving dinner, and one person has COVID, in 18 minutes, it is likely that they will have transmitted the virus to someone else. If they wore cloth masks and were not eating, they're just staring at each other over the Thanksgiving table, they added about 6 minutes to the time to exposure. If they opened a window, they added 10 minutes to the time of exposure. If you wore a medical surgical mask, you added 2 hours to the time to exposure. So talking from a guy who has his fun holiday mask that he's been wearing, I have been wearing a surgical mask all weekend now. So you will never see my Rudolph the Red-Nosed Reindeer mask again, unless it's over top of my surgical mask. The final piece that I thought was interesting, they simulated 180,000 square foot store like a Walmart, and showed that the risk of exposure if one person was infected was actually quite low. But again, the type of mask did matter. If you went to the incidence of in Chicago, where there could be 15 people of 1,000 that would be in the store at one time shopping, they showed it was 6-fold the risk of exposure to the virus. So it just goes to show masking does matter, especially holidays. Who crowds? I mean, 10 people around the Thanksgiving table is probably a good size family gathering. 20 by 20 room is probably bigger than most people have. And to have 18 minutes before one person would be exposed or contract the virus, if you can eat Thanksgiving dinner in under 18 minutes, you're doing even better than I can. So all that being said, I think the surgical masks probably do have a lot more merit. Again, any mask is better than nothing, but I did think that was interesting, especially as we're looking towards the holidays and anticipated get-togethers that will follow. So more to come on that, and I'll try to share the exact study from that. Final things for me, due to popular feedback, we're holding our webinar today, obviously, welcome. We are not holding our webinar on Wednesday because folks are going to be away. We are also not going to hold the webinar on Wednesday the 30th. So we will hold it next Monday the 28th and today, but we will not do Wednesday the 23rd or 30th. It seemed that there were a lot of folks who were not terribly eager, and that's understandable. We will, however, have our PPE distribution on Wednesday, December 30th. We should have everything your heart desires for that. As I understand, it sounds like by hopefully the beginning of February, we will have that large purchase that we are making of N95s and gowns, which will put us somewhere to the tune of about 40,000 N95s and 40,000 gowns in our possession, which is a pretty good volume for us as far as what we're distributing. So that should keep us pretty well covered for a while. Okay, so that's all I have. LJ, do you have anything you want to throw in? That looks like a no.
No, I don't. Thank you.
Okay.
There's some things in the chat.
Yeah, I'm just going to start from the top here.
Okay.
Okay. Is it possible there will be less pediatric testing because kids won't need to return to school? I pray. So if the gods are with us, the next couple of weeks while the kids are out of school is going to be a lower draw on testing. Absolutely. They're already factoring that into their calculus. But I hope that that's actually a break on all of you as well. Will there be less? Sorry, my reading skills are possibly not as good as some of you. When and how community physicians get in line for the vaccine. I think we covered that. I'm dying of COVID. We covered that.
There was a question about whether we anticipated that, in addition to the things you were talking about, Chad, about getting lists and raising the issue about ambulatory pediatric providers getting vaccine from U of R distribution. Do we anticipate Monroe County Health Department will announce when ambulatory physicians can proceed to CVS, Walgreens, et cetera?
Yeah, so as I understand it right now, CVS and Walgreens have been tasked with doing vaccination for nursing homes and nursing home staff. And they will then most likely be tasked with vaccinating communal living, so group homes, IDD facilities and the like. So if my read on that is correct, they are going to have a pretty full plate just by dealing with those groups alone. So I do not anticipate that our teams will be going to CVS and Walgreens. I don't know that for sure, but it just didn't sound like that was likely. I do suspect that somewhere between the health department, the U of R as the regional coordinating hub, and the task force that Nana Bennett is setting up, that will be where all of us will get our vaccination. Right now, I would anticipate that will likely be vaccine clinics that folks will be invited to. It could get to the point very quickly because I did hear today from one practice that had potentially already gotten outreach about vaccine distribution to their practice. So that may be coming in the days ahead. Obviously, if that were to happen before you were invited to one of these vaccination clinics, if you did get vaccinated yourself, then the first plan would be, obviously, I would anticipate for you to vaccinate yourself and your own employees before giving it to the tier 2 high risk patients. So a lot of this is going to get clarified in the next 24 to 48 hours. I realize that means you won't hear from us again until Monday with some of that clarification. But truthfully, I don't think any of us are going to get vaccinated before Monday. So Monday, we should have pretty good information, hopefully, about what the anticipated timeline, a little bit more granular is what that timeline will be. Clarification about what asymptomatic essential employees should do while their COVID test is pending. They should put on a surgical mask and a face mask, and as long as they're afebrile, they should come to work. So if you are COVID exposed and afebrile, oh, looky there, it's in the email, yay. So if you are COVID exposed but not manifesting symptoms, and you are an essential worker, whether you are a cashier at Wegmans or MA in our offices, you are cleared to work as long as you are checking your temperature daily and not having any symptoms while you're waiting your test results to come back. If you mount symptoms, that's where you have to go under quarantine. So if you become febrile or you have other COVID symptoms and you have a positive COVID exposure, especially if you were contact traced, then you would go into that 14-day quarantine awaiting testing and recovery of symptoms. So I know this comes up a lot, but that is the rule as it stands that everyone should be following. And Renee has it up on the screen for everyone's viewing pleasure. How will you be notified about appointments for the vaccine? So right now it is happening via email that it is coming out to the individual staff or providers, inviting them to get vaccinated. As we get into this wider distribution to all of us, what I would anticipate is it will probably start happening on a practice by practice basis. That's what we kind of talked about before. Again, does this mean that if I'm in Brighton, I'm going to get my vaccine faster than if I'm in Ontario County? No, it does not. Right now, I think they vaccinated somewhere on the order of 500, 600 in a day last week. So we're going to be clipping through, once we get into ambulatory practices, we're going to be clipping through ambulatory practices pretty quickly. And there's going to be several sites functioning simultaneously. So Highland has a team, Strong has a couple of teams, FF Thompson has a team. So they'll be pushing through volumes of people very quickly. But yes, right now my anticipation would be if they ask us for our lists, we would submit that, and then my hope would be probably very quickly it's okay. The following 6 practices, who do I reach out to? Or they go through AHP, and then we would immediately reach out to you to get your staff scheduled. But more to come on that. Like I said, I'll have much more detail about that in the coming days, but right now it has all been electronic scheduling at this moment. It's about 3.5 minutes per person. So this is not a big, long to do. You come in as fast as you can get your shirt sleeve up. They give you the vaccine. They give you your card, which tells you your next appointment date, and they give you the card showing the vaccine, the lot that you received for your own record keeping purposes. Where should practices submit their tiered list? Just email it to me for right now. I'm keeping my own email folder of all the practices. So just send that to me and I'll keep it safe and ready to be distributed whenever they ask for it. I think that covers most of the questions. All right. So that's a lot. We got a few more minutes. So any other questions that folks have that we did not cover?
It's Carolyn. When you were saying about incentivizing healthcare workers, nurses to get it, obviously there are rules. If you didn't get the flu shot, was you have to wear a mask. Now we're all wearing masks. Is you are doing any kind of disincentive, incentive, motivation for staff that refuse? Any rules that the refusing staff have to comply by?
That's a good question. So, the question for those who couldn't hear it, is the U of R providing either any incentive or disincentive? So with the flu vaccination, if you refuse to get the flu vaccine, you have to mask, you have to go through a little bit more steps, if you will, when you're working. As of right now, the answer is no. There is no incentive or disincentive being offered at the moment. It's still very much an elective process. And truthfully, while I think we can make arguments for and against incentives or disincentives, for the minority populations in particular, the one thing that I've heard again and again that they are most concerned about is they do not want to feel compelled or coerced into having to take the vaccine. So I think the more that we make this optional, good, bad, or indifferent, the farther that's going to go as we start talking about those high risk, maybe potentially more skeptical communities. That if we're not coercing our own, we wouldn't be coercing them either. So, there has been a lot of discussion about it, but as of yet, there are no incentive disincentives being offered. All right. No more activity in the chat room, and that is the only question. So we will break for the holiday season. Everyone have a lovely, don't see family, don't see anyone holiday season. If you are going to see someone, wear a surgical mask. We have plenty. I would rather people take those than wear some questionable cloth mask, just based on what the MIT folks are telling us. And we will be back here on Monday to review again. We will send out our email today as we have been. If there's anything majorly exciting, we will communicate it sooner, but obviously with the holiday, I'm not expecting to hear a lot of major press releases in the coming days. But hopefully by the time we get back together, we will be talking about timelines and plans for all of us to get vaccinated. So there you go. Much appreciated. Have a lovely Christmas for those who are celebrating, and we will see you back here on Monday. Take care, everybody.
Bye.
Merry Christmas.
Thanks, Jess.
Bye-bye.